Hello and welcome to today's lecture. I'm Ibulani and I'll be guiding you to today's topic. The nursing management for patients with lung cancer will be the main topic of this week. Before watching this video, I hope you read your textbook, and this lecture is intended to provide you with useful, understandable insights as we review and expand your knowledge of the subject. To make things as simple as possible, we'll go over the main ideas one by one, providing examples and clarifications. So take out your notes, take a seat, and let's begin. Okay, next. Before we begin, let's take a quick look at our learning objectives for this session. These objectives will guide our focus and help you to understand exactly what you're expected to learn and take away from this video. By the end of this session, you should be able to understand the pathophysiology and medical management of lung cancer, and the second one, that you are be able to formulate appropriate and systematic nursing assessment, diagnosis, intervention, implementation, and evaluations for patients with lung cancer. Okay, next, often called a silent killer, lung cancer typically shows no symptoms until it is in advanced stage. It is the most commonly diagnosed cancer globally and remains the leading cause of cancer-related death, more than breast, prostate, and colon cancers combined. For decades, smoking has been the primary culprit, but today we're facing a new reality. Lung cancer is increasingly being diagnosed in non-smokers due to factors like air pollution, occupational hazard, and genetic predispositions. Here is the critical points on lung cancer that you need to know and understand. Lung cancer is a type of cancer that begins in the lungs and most commonly in the cells lining the air passages. It occurs when abdominal cells grow uncontrollably from form tumors and can eventually spread to other parts of the body. The main etiology and risk factor is, of course, cigarette smoking. It is responsible for 80 to 90 cases, and there are other risk factors such as exposure to asbestos, radon pollutions, genetic predispositions, and also other occupational hazard. There are two main types of lung cancer. The first one is non-small cell lung cancer. It is taken 85% of the cases worldwide. And the second one is small cell lung cancer, and it is take like 15% of cases. It is really highly aggressive, early metastasis, but with poor prognosis. You have to understand that lung cancer metastasizes primarily by direct extension and through the blood and of course the lymph system. The common sites for metastasis are the lymph nodes, liver, brain, bones, and also the adrenal glands. It is really important for you to understand all the critical points on lung cancer because it will help you to understand the pathophysiology of this disease and also what is the clinical manifestations that related to this disease. Okay, next we are going to talk about the interprofessional care for lung cancer. From the previous video, if you already learn and watch about the pathophysiology of lung cancer, and for now you are going to learn about how the doctors, the nurses, and other healthcare providers treat this lung cancer. Okay, for the diagnosis assessment, accurate assessment of lung cancer is really critical for staging and determining appropriate treatment. Bone scans and CT scans of the brain, pelvis, abdomen are used to determine if the metastatic disease is present. A complete history and physical examination, as you can see, with some laboratory results such as CBC, chemistry panel, liver function, and also renal function are ordered for this kind of situation. And also in other situation, pulmonary function tests will be done. An MRI and positron emission tomography or PET may be used to evaluate and stage lung cancer. So, all the assessment for the diagnosis is really important. So you have to understand and you have to be able to identify what kind of assessment that um you will need to get the diagnosis of lung cancer. The next one is the management for the lung cancer. There are many intervention or medical management related to lung cancer, but the main thing is the surgery, um, whether it's segmental or wedge resection, lobectomy or pneumectomy. The next one is radiation therapy and chemotherapy, target therapy and immunotherapy, and so on. There are a lot of management. You can open your Lewis book and please take a look at the book and then read it carefully. Okay, next we are going to talk about the nursing management for the lung cancer. It is the part that nurses do their assessment, gathering the data, and then put it into a diagnosis, making outcomes, planning, implementation, and evaluations. Let's start with the first step, which is the nursing assessment. It is really important to determine the patient's and caregiver understanding of the current medical condition of the patients. Diagnostic tests um, that those complete as well as those planned, like I said before in medical management, diagnosis or potential diagnosis, treatment option, and also the prognosis. It's really important for you to assess the patient's level of anxiety and support provided by the patient's significant others or family. That's why the subjective and objective data should be obtained from patient with lung cancer as described in this table. There are several data that you need to gather. The first one is the subjective data. It's really important for you to gain the health information related to past health history. What is the history of the exposure? If the patient is smoking or not, if there is any airborne carcinogens near the patients, is there any chronic lung disease like COPD or tuberculosis or bronchiectasis, and also if the patient have history of cancer. The next one, you can ask about the functional health patterns, the health perception, health management, nutritional, metabolic, and also the last one is the cognitive perceptual related to the pain. After you gather the subjective data, you will make sure the objective data. In general, you can assess whether the patient have fever, have nose or throat infection, and also if the patient have edema of the neck and the face, jaundice, digital clubbing, whether the patient have wheezing, hoarseness, stidor, deep snow, and a lot of things that you can see in these tables. The important thing that while you gathering this data is really important to look into your patient's condition and adjust with the focus assessment that you need to do, especially on respiratory assessment. There is possible diagnostic findings that may relate it to your assessment as a nurses. So you have to check on the patient's chest X-ray, CT scan, PET scan, MRI, and also positive sputum or bronchial washing, and also biopsy of the lungs. It's really important for you to integrate your assessments with medical findings. It will help you um, to get the most accurate nursing diagnosis for the patients. Okay, for the next thing, we are going to focus on the diagnosis and planning. Here is the potential nursing diagnosis that the patient can have. The first one is impaired airway clearance, impaired breathing, impaired gas exchange, and also anxiety. And for the planning, the overall goals that for the patient with lung cancer will have adequate airway clearance, effective breathing patterns, adequate oxygenations of tissues, minimal or to no discomfort, and also a realistic outlook about the treatment and prognosis. These outcomes is really important for you so that you can plan and what you can plan what kind of intervention that um you need to write on your nursing care plan to be able to achieve these outcomes or goals. Okay, next, as usual, the nursing implementation is divided into three parts: health promotion, acute care, and also ambulatory care. For the first part, for the health promotion, there is a prevent, support, and protect. Prevent smoking, especially intense, is the best way to stop lung cancer. It is to prevent smoking before it starts. The smokers begins in their teenage year, so preventing teens to smoke is the key. Education in schools, public awareness campaigns, and parental guidelines are important tools. Second one is support. Support for the smokers to quit. The nurses and healthcare workers play a big role by encouraging people to quit and setting a good example by not smoking. Promoting smoking cessation program and supporting public education can make quitting easier for many. And the third part is the protect people from secondhand smoke. Secondhand smoke is really harmful and can cause health problems even for non-smokers. Laws now ban smoking in most public places and limit it to special areas. Hospitals are mostly smoke free, and some now refuse to hire people with test positive for nicotine. These changes really help to create a healthier environment for everyone. Next, the nursing implementation in acute care settings. There are three main intervention: support and emotional care, treatment and symptoms management, and patient education and coping. The first one, support and emotional care. It's really important for the nurses to give emotional support and reassurance during diagnosis. You need to understand that patients may feel overwhelmed by stress when they get the first diagnosis related to cancer, and stress can come from symptoms like coughing or breathing problems. The patient may also worry about family responsibility during the treatment. That's why it's really important for you to understand the patient's psychological state while you're asking and giving implementations. You need to assess each patient's unique stressors to provide better support. The second implementation is treatment and symptoms management. Your nursing care depends on the type of the treatment, whether the patient had surgery, radiation, or chemotherapy. It is really important for you to focus on managing symptoms like pain, cough, or shortness of breath. You can teach patients to recognize warning signs such as coughing up blood, chest pain, trouble swallowing, or hoarseness. It is really important also to monitor for the side effects of medication, um, especially during the chemotherapy. The last implementations is patients education and coping. You can teach ways to reduce pain and improve comfort to patients. Encourage the patient for healthy coping strategies for both patient and also caregiver or family, and assess if the patient is ready to quit smoking and offer help. You can also help the patient by connecting them with resources and other support services. Okay, the next thing is the nursing implementation in ambulatory care. There are four main implementation. The first one is create a smoke-free environment. Encourage the patients and families to stop smoking. A smoke-free home helps reduce lung cancer risk for everyone and support smoking cessation for all family members if needed. The second one is safe use of home oxygen. If the patient needs oxygen at home, teach them how to safely use the oxygen. Smoking near oxygen is really dangerous and must be avoided. The third implementation is focus on comfort and palliative care. In the advanced stages, treatment may not cure but can relieve symptoms. Radiation and chemotherapy can help reduce pain and discomfort. Pain management is really important and should be addressed by the nurses. The last one is end of life support. Involve the palliative care team early to support patients and family in this stage. They will help with emotional support, disability info, financial planning, and also access to hospice or home care services related to the end of life support. The last part of the nursing process or nursing care plan is the nursing evaluations. The expected outcomes are the patient with lung cancer will be able to have adequate breathing patterns, maintain adequate oxygenation, and have minimal to no pain. Also, it is hopefully, the patient will be able to convey or to confess his feeling openly and honestly to the nurses and also to the family with a realistic attitude about the prognosis of the disease. That's all about the nursing management for patient with lung cancer. We covered all the key points on nursing management, and I hope it's really helped you to understand the topic better. It is not detailed, but you need to look at your books, look at the journals, look at other videos to strengthen your understanding related to the topic. Please take some time to review what we've discussed in this video and feel free to revisit this video whenever you need a refresher. Thank you for watching and see you in the next video.